Welcome, my dear students. This is Dr. Hani Nadeem, and this is the second lecture on the development of the cardiovascular system. In case you haven't watched the first lecture, please watch it first. It will make this one easy for you to understand. In this lecture, we are going to study the fate of the sinus venosus and the fate of the veins attached to it. The sinus venosus is the caudal-most chamber of the heart tube. It opens into the back of the common atrium. This is a back view where we can see the sinus venosus marked in this light blue color, opening into the back of the common atrium in pink color. As you can see, the sinus venosus is made of a body and two horns, right horn and left horn. Each horn receives three veins. A common cardinal vein which drains the body of the embryo, made by union of anterior cardinal vein and posterior cardinal vein. The second one is the umbilical vein, which brings blood from the placenta. The third one is the vitelline vein, which brings blood from the yolk sac. The opening of the sinus venosus into the back of the atrium as seen from the front. This is a front view of a coronally cut common atrium, where we can see the opening of the sinus venosus fusiform in shape or a vertical slit. It is guarded by two venous valves, right venous valve and left venous valve, which are marked by the yellow color, whereas the sinus venosus itself has this pale blue color. The two venous valves fuse above to form what's called septum spurium. Spurium means false. This is not the real or the actual final interatrial septum that divides the common atrium into right and left atria. We will see right now why. Because left to right shunt of venous blood occurs in the embryo, shifting the opening of the sinus venosus to the site of the future right atrium and pushing this false septum or septum spurium to the right with it. This is the early appearance of the sinus venosus. Now, when we talk about the fate, we have to talk about the fate of the two horns, the right and left, the fate of the six veins, the three on the right side and the three on the left side, and the fate of the two venous valves, the right and the left. Let's start with the two horns. Shift of venous blood from left side to right side, remember this is a back view, will make the right horn of the sinus venosus enlarge in size. This enlarged right horn will become incorporated into the right atrium. How? By widening of the sinoatrial orifice. The two venous valves become separated apart from one another so that the two chambers become communicating together as one chamber. So the right horn of the sinus venosus will make the posterior smooth part of the right atrium, commonly known as the venous sinus or sinus venerum, whereas this part of the common atrium will form the rough part which contains the musculi pectinati. Regarding the six veins, as we see here, three of them disappear and three will remain. Let's forget about those who disappear and talk about the three ones which remain. The three that remain are the right common cardinal, the left common cardinal, the two common cardinals, and the right vitelline. The rest disappear. Two common cardinals and one vitelline. The right common cardinal will make the opening, the vein, the large vein that opens on the upper part of the smooth part of the right atrium. This is the superior vena cava. As a matter of fact, it makes the lower half of the superior vena cava. This is a diagram. This is also a diagram, but it's more close to reality. This is superior vena cava. This is the superior vena cava opening into the right atrium. How about the right vital line? It will make the vein that opens in the lower part of the superior vena cava, which is the, yes, right, it's the inferior vena cava. Well, how about the left common cardinal? What would it give? I don't see big veins here. Well, the left common cardinal will become very small and it will form the a vein on the back of the left atrium running obliquely. That is why it is called oblique vein of left atrium. This oblique vein of left atrium, which originally is connected with the left horn of the sinus venosus and the body, the left horn of the sinus venosus and its body will become reduced in size to form the coronary sinus that drains venous blood from the heart into the right atrium. So now, as you can see, the 6 veins will give the veins that open into the right atrium. As a matter of fact, the right horn gives part of the right atrium, the left horn gives the coronary sinus that opens in the right atrium. The 3 remaining veins will form the superior vena cava, the inferior vena cava, and the oblique vein of left atrium. Now, how about the 2 venous valves? Here we are. This is the right and this is the left. The right, as you can see here, it makes a ridge separating the smooth part from the rough part of the right atrium. Of course, this is the crista terminalis. In addition, it gives 2 valves here. Its lower part forms 2 valves. A valve for the inferior vena cava and a valve for the coronary sinus. This and that. Well, how about the superior vena cava? It does not have a valve. Any vein that drains against gravity contains valves. Any vein that drains with gravity does not have any valves. Well, how about the left venous valve and the septum spurium? As the opening widens, they approach the developing interatrial septum and diffuse to it, giving part of it. So to summarize the fate of the sinus venosus, the fate of the 2 horns, the right forms part of the right atrium, the smooth part, while the left forms the coronary sinus. The 6 veins, 3 of them remain and 3 disappear. Those 3 remaining veins give the lower part of superior vena cava, upper end of inferior vena cava, and oblique vein of left atrium. These were the 2 common cardinals, and this was the right vital line. The 2 venous valves, the right will give important remnants in the right atrium, crista terminalis, valve of inferior vena cava, valve of coronary sinus, whereas the left with the septum spurium will form one of 4 components of the interatrial septum. Now let's test if you captured the main idea. Let's answer this question, cross-match A with B. I'll give you some time to think on your own. You can pause the video, try to answer, and I will give you the answer in a while. Well, now let's see the answer. Okay, the smooth part of the right atrium, where does it come from? Right horn of sinus venosus. Where is it? Right horn of sinus venosus. Well, the lower part of superior vena cava, where does it come from? One of the veins, the right common cardinal vein. Here it is. Okay, the crista terminalis, oh yeah, one of the venous valves, the right one. Right venous valve, here we go. How about the oblique vein of left atrium? Oblique vein, oh, this was, okay, left common cardinal vein. By the way, this vein, if it had the chance to grow, because its counterpart is the superior vena cava, if it grows, it will make a second superior vena cava, a left superior vena cava. So this patient may have double superior vena cava, as we will see later. Last but not least, the coronary sinus. Well, coronary is the left horn of the sinus venosus. Okay. Now let's come to the three veins that were connected. Let's have some details on them. This is a front view earlier, and this is a late view after transformation of the veins. Okay. Well, as you see, we have here the common atrium, the two horns of the sinus venosus. Now we're looking from the front, so this is the right horn and this is the left horn. What's here? This is the gut tube. This is the liver, the developing liver. Okay. And the septum transversum, both of them. Now we can see here the three veins joining the each horn of the sinus venosus on this side and on this side. Well, let's start by this and this. These are the two common cardinals, the right and the left. Each is made by union of posterior cardinal and anterior cardinal. What's this? Well, between the two anterior cardinal veins, an oblique anastomosis develops. Well, what would this give? Let's look in later life, after development is complete. What's this? What this reminds you of? Veins in the thorax. Yes, this is the left brachiocephalic vein, comes from the oblique anastomosis, and the left anterior cardinal vein, and the rest of the anterior cardinal vein disappears. Okay, how about the anterior cardinal on the right side? Before the oblique anastomosis, it gives the right brachiocephalic vein, whereas just below the oblique anastomosis, it gives the upper half of superior vena cava. Well, how about the rest of the right common cardinal? It gives the lower half of superior vena cava, as we just said. The left common cardinal gives the oblique vein of left atrium, which opens in the coronary sinus. How about the posterior cardinals? They disappear totally, except they make the iliac veins in the lumbar region, and just a small part remains here, giving the arch of azygos vein. This summarizes the fate of the cardinal veins. They make the brachiocephalic and superior vena caval system. How about the vital line veins? We have right vital line and left vital line. They become connected by channels across the gut. Parts of this channel disappear and parts remain, giving the portal vein, here it is, okay, around the duodenum. It's made of, by union of two veins, the superior mesenteric and splenic, and it gives right and left branches which enter the liver. So the subhepatic part, or the part just below the septum transversum, will make the portal venous system. The part inside the septum transversum, or the liver, the growing liver, will be invaded by cords of liver cells growing from the duodenum, right, from liver bud, and these cords will split those veins into liver sinusoids. Okay, how about the suprahepatic portion of these veins? Well, the left one will separate and joins the right one. Both form the common hepatic veins, right and left, which unite to form the uppermost part of the inferior vena cava. Now what's left for us is the umbilical veins, the right and the left. The right disappears very early in life, leaving only one umbilical vein. Remember, in histology, you used to see the cut section of the umbilical vein with two eyes and a mouth. The mouth was the umbilical vein, the single one, and the two eyes were the umbilical arteries. You have to remember that the umbilical vein, although it is a vein, it carries oxygenated blood from the placenta to the baby, to the embryo. This umbilical vein will join here the left branch of portal vein. Okay, how about the hepatic portion and suprahepatic portion? They disappear, and a new channel or a new duct will form, shunting blood from the umbilical vein here to the inferior vena cava to reach the right atrium. Remember, this blood is oxygenated blood. It should not mix with unoxygenated blood here. So it goes through this channel or this duct, which is called ductus venosus, to reach the inferior vena cava, which carries this oxygenated blood to the right atrium. So in summary, we can say that we have three systems of veins. The cardinal system is made of two common cardinals, each by union of anterior and posterior cardinal. The two anterior cardinals joined by oblique anastomosis, which makes the left brachiocephalic. Now, the anterior cardinal is divided into two portions. The upper part gives the right brachiocephalic. The lower part gives part of the superior vena cava. The rest of the superior vena cava is from the right common cardinal. In the middle, the superior vena cava receives the arch of azygos vein, which comes from the posterior cardinal vein on the right side. The left common cardinal, which was supposed to give a superior vena cava, it will become reduced to make the oblique vein of left atrium. This is about the cardinal veins. Regarding the vitelline veins, right and left, going through septum transversum to each horn, subhepatic portion will make the portal venous system. Hepatic portion will make liver sinusoids. Suprahepatic portion will make two hepatic veins joining the uppermost part of inferior vena cava. The two umbilical veins, the right disappears, the left remains, and a new channel, the rest of it loses connection with the left horn of the sinus venosus, and a new channel called ductus venosus shunts blood from the umbilical vein to the inferior vena cava. Now, let's come to see the anomalies of the superior vena cava. This is a back view, as you can see here. These are the ventricles, left and right. These are the atria, left and right. This is the coronary sinus. This is the inferior vena cava. This is the superior vena cava made by union of right brachiocephalic and left brachiocephalic veins. And of course, each brachiocephalic is made by union of subclavian and internal jugular vein. This is the normal, okay? Well, sometimes we may have left superior vena cava or double superior vena cava. How can you explain the occurrence of left superior vena cava? Well, it may happen if the oblique anastomosis connecting the two anterior cardinal veins shunts blood from right side to left side, right? While the anterior cardinal here and the common cardinal here will become reduced in size. So, in such case, the anterior cardinal on the left side remains. This was supposed to disappear, all right? And instead of making oblique vein of left atrium, the left common cardinal will join the left horn, which is the coronary sinus, which becomes very large. So if you have a left superior vena cava, okay, there will be no superior vena cava on the right side opening into the right atrium. This left superior vena cava will drain to the right atrium also, but through the enlarged coronary sinus. Well, this second anomaly, or double superior vena cava, can be explained by no formation of the oblique anastomosis. As we said before, this oblique anastomosis is important to make shunting of blood from the left to the right side, making the right veins enlarge, the left veins reduced in size. If it does not form, in such case, both veins, the right and the left, remain large. The right will make a right superior vena cava that opens into the right atrium directly, while the left will make a left superior vena cava that will open into the coronary sinus, which is enlarged, and it carries the blood to the right atrium. Well, to summarize what we said in this lecture, we said that in the fate of the sinus venosus, we have to talk about the fate of the two horns. The right enlarges and the left becomes small, making coronary sinus. The fate of the two venous valves. The right is important as the crista terminalis and two valves. The left shares in the interatrial septum. The 6 veins, 3 disappear, 3 remain. The 2 cardinals remain, the right giving superior vena cava, the left giving oblique vein. The vital line, which makes the superior vena cava. And we talked about more details of the cardinal veins, about the oblique anastomosis and its fate. And we talked about the vital line veins as they pass through the liver, subhepatic part, portal vein, hepatic part, sinusoids, suprahepatic part, inferior vena cava with 2 hepatic veins. And the umbilical veins, the right disappears, the left remains and continues as the ductus venosus. Thank you for listening. I hope this lecture was useful for you. If you find it so, please subscribe to my channel and push the like button. Thank you so much.